We'll just start off then, if I may, with Ceredigion. It's closing its leisure centres, some sporting facilities. They're not in local lockdown measures. Here in Carmarthenshire, Llanelli Leisure Centre is being reopened. Some people are expressing their incredulity at this. Would you be intervening in any way in this?
No, they're choices for the local authority to make. The choice about opening leisure centres is not as straightforward as might appear, because we understand that exercise is broadly a good thing, not just in terms of physical health, but mental health and well-being as well. But also we want to understand where and how services can operate safely. And if people follow the rules, then it's still possible to have indoor facilities, including exercise, available for people. I know that Ceredigion have always taken an ultra-cautious approach, but they're certainly not closing leisure centres because the Welsh Government either told them to, or because our guidance in some way directs them to do that. And this is part of the choice that people make, and it's why people elect local authorities to make choices and understand their own local communities.
There's been a lot of speculation about the COVID-19 testing error rate and its application to overall numbers for testing for COVID-19. Are you confident that the calculations are 100% accurate?
Yeah, look, even with the tests that we have, which are highly accurate, there is a very, very small error rate. But actually, the overall picture is one that is definitely accurate. We've got a very accurate test that we have available to us in the UK. Part of our challenge, though, is that with the Lighthouse Labs, I'm more concerned about the timeliness of the results we're getting through now and the challenges of access rather than the accuracy of the tests. And our Public Health Wales laboratory tests that we run as well, they actually give us more information. So they're able to tell us about the pattern of infection, the genomic identity. That tells us who and where people are mixing with. So it could, for example, tell us if someone's got a strain of COVID that originates in Greece, for example, rather than something that appears to be more linked to UK widespread. So that's my concern. Access rather than accuracy is the big concern. And I hope that people, because there's lots of information swirling around and lots of broadly conspiracy theory stories about the fact that the tests don't mean anything. That simply isn't true. We've got a good, accurate test. My concern is getting good access to it and then fast turnaround of the results.
Students went back to colleges and universities only to be told they're having little face-to-face contact with the main element of their courses being delivered online. They travel from all across the UK only to be locked into the halls. What lessons can the Welsh Government learn from this latest episode, and what, if any, steps are going to be taken to compensate the students? I know this is autonomous for universities, but have you any thoughts on that?
Well, look, each university has got their own plans for what to do if they have localised outbreaks. And what we need to do is we need to treat students just as we do any other group of adults. So what I don't want is an impression created that students are uniquely responsible for the base of the country finding itself in, or can be uniquely herded and rounded up together in a way we wouldn't do with other members of the public, for example, living in single flatted accommodation within a university town or city. And it is then important to make sure that students get an experience that is safe, as COVID secure as possible. But the ending of face-to-face teaching in Aberystwyth is a decision for the institution and their local partners. It isn't something that we have driven or required people to do. You'll see that it isn't a decision made in other university institutions in Wales, and I don't think Trinity Carmarthen are doing that. I don't think that other Swansea institutions are doing that either. So it's a choice. What we want people to do is to understand and follow the rules. That's about protecting students and staff and the towns, cities and communities that they're operating in. Universities bring great benefits and economic benefits to communities. They bring challenges as well. What we're looking to do is to make sure that our testing infrastructure can support people so we can understand where there are outbreaks, how we get tests to people or that they're readily accessible. So we're hoping to have a wider range of testing, walk-in testing centres. That's being developed in partnership between the Welsh Government and the UK Government for the Lighthouse Lab process. Once it's turned around, we should have more testing centres available, not just for university communities, but actually the community itself. We also then need to make sure that our high-performing Test, Trace, Protect service works as well, because that'll tell us more about who we need to isolate, where the chain of transmission are, And that's a targeted approach we're going to take with the whole population, not just for students.
You may be aware of the backlog of appointments for treatment for a number of health issues within our community. It's difficult to see a doctor. Okay, it's online. You can call at 8:30 in the morning and you may be put on a waiting list and so on. What's being done to reduce the backlog and reduce the waiting time for health-related problems in Wales?
So there are two distinct things, I think. The first is that access to your general practice, your local health service, is one that has changed. So, it isn't that general practice isn't busy, it's still incredibly busy. More people are accessing on the telephone or through online video consultations. The doctors are working differently, and lots of members of the public find that a real plus and a real benefit. Before the coronavirus pandemic, we had some challenges in access, and I'd introduced some new access standards and some money to invest in general practice to allow people to achieve that, to make sure that calls are answered in a reasonable time, and to make sure that people don't have the well-advertised problems they've had over the last year, where in localised areas there have been challenges in access. And what you find is that practice can vary from one practice to another. So we're trying to level that up. And that's still our ambition and our expectation we're able to do more of that. So you'll expect telephone and online appointments and access to continue, not just through the pandemic, to be part of the normal mix for the future. When it comes to the broader delays we got in large parts of healthcare, that's going to be a really big challenge, not just for today, but for the future. So whether it's on the backlog and people who were worried, so they opted out of treatment, that happened during the first phase of the pandemic. That happened really serious. So, whether it's heart care, respiratory care, cancer care, a range of people didn't want to come in, even though the services were open. And then, of course, I took a decision in the middle of March to end lots of elective care, for sort of knees, hips, and lots of other operation where there's a real issue about people's ability to get around and live their life. And so people have had some discomfort. What we're trying to do in return the tap back on, we've been progressively restarting parts of our healthcare system, is that we recognise we got the backlog from activity that didn't take place. We've also got the honest challenge that if you went in to have a NEOP today, you would find that the team undertaking your operation wearing much more PPE than they would have done in January this year. And that actually means they're not able to do as many procedures in the day. So whilst our demand, we've got this bubble to deal with, we can't undertake the normal waiting list initiatives to eat into that backlog because our staff are having to work extra hard just to keep up with the demand that's coming in. And actually, it's not just a challenge for Wales, every part of the UK health system. It's going to take several years. And I've already indicated that, honestly, I think it'll take a full Welsh Parliament term to get back on top of that, because we're not going to find a normal way of working until we're at the point where there's a vaccine or effective antiviral treatment for COVID. So that's an honest challenge. The money we're putting into the health service now is about surviving and maintaining the system we have, not about the ability to simply eat into those backlogs. But I would encourage people, if you've got urgent care needs, whether it's for, if you're somebody who's had a stroke, had a heart attack, or if you've got cancer appointments, then please do come into the health service, because we've reorganised where our hospitals work. So there's a non-COVID path where people don't have COVID, and there's also the COVID possible and COVID confirmed path to try to separate people off, to give people confidence to come in and undertake treatment and not risk longer-term damage to their own health.
We've seen the boundary-by-boundary approach applied, with some saying it adds to some confusion. Who can do what and when, who can go where, etc. Does the Minister believe that the Welsh Government has provided adequate and clear guidance, and does he have any concerns that there may be elements in our community, specifically the elderly and poverty, who may not have access to apps or online information, or even if they do, they may not be able to digest and understand it in the same way as they would a bullet point leaflet, for instance?
Communication is a big challenge for us. We're not just relying on the online and social media world. You'll recall, because you attended and asked questions at a Welsh Government press conference, we're directly engaging with local press, not just our national broadcasters, and I think that's really important. I've just done an interview earlier today with another local radio station, and I've done local radio interviews for pretty much all of the local lockdown areas. So we're thinking about that traditional source of media as well as newer digital media, because different people get their information in different ways. And we're trying to be as clear as possible. Whenever we're having a boundary to the restrictions we're imposing, there is always a risk that people on the edge of I think that it intervenes in their lives in a way that is particularly unfair. This comes back to the fact that there isn't a perfect choice. We could have chosen to take measures across the whole of Carmarthenshire, when actually it's in the Llanelli area in particular that we've got a challenge. So the balance there was that it was right to do this in the Llanelli area, not in the rest of more rural Carmarthenshire. We don't have the same issue in Carmarthen Town and others in the county. That's the approach that we'll take if it's possible. In other local authorities in Wales where we've introduced restrictions, we haven't been able to do that because the spread has been broadly across the whole of that county area. So it does depend on the circumstances we find, and we do then try to be as clear as possible. And to be fair, I think that local authority leaderships of all political colours have been very constructive and grown up in their engagement with us. And I also think that local media are doing a fantastic job in communicating to their local population what is happening, because you reach people that other broadcasters don't get to. And I think it is not one or the other, it's all those different ways of communicating with our local public.
Essentially, what you were talking about earlier was a universal approach almost. If everybody follows the rules, adheres to the rules and uses the track and trace and so on, that's something that eventually will sort of see the reduction. But do you think that families and employers should be given free or cost price temperature checking gauges as a means to establishing, before you even go out in the morning, am I okay? Have I got the symptoms?
Well, we've actually looked at this, in particular around schools. There was a demand to ask whether every school should temperature check children on the way in. And actually the technical and medical evidence didn't support that being an effective measure. So it's always about doing what is effective. And there are things that sound rational and logical that might work, but when we test them with the evidence, don't provide the benefit you might think they might do. And that's one of the challenges we have. How do you make a choice that is supported by evidence to give the benefit that we all want to see? And how do you politely deal with all the ideas people will have in good faith and explain why you're not doing things that other people might think work? And it's actually part of the reason why the conversation with the media in all its forms is really important. But I think without that sort of honesty about the evidence, we're not going to have the public believe the message we're giving and how we're taking measures to keep people safe. So I think that's really important. We definitely don't want to lose sight of that.
We heard some terrible stories of treatment and conditions at residential care homes for the elderly during the lockdown. Are you confident that homes are being monitored for standards, given that we're back to the behind closed doors scenario, where families have to rely on care home staff to provide the information relating to their loved ones?
I'm sorry, this is the last question I'm going to be able to deal with today, but we're concerned about the position in care homes. And so from the start of the pandemic, we understood that there was a problem, that care homes were a vulnerable population. And so we had some challenges working across the whole sector because PPE supplies broke down. It's the legal responsibility of the employer to provide PPE to their staff. But when those supply lines broke down across the world, what we did in the government was that we used our NHS resources and supply chains to provide supplies for the social care service. I know Carmarthenshire at one point were looking to buy their own PPE supply, but actually even a whole county approach to procurement didn't work and they couldn't bring those PPE supplies in. The NHS supplies have come good though. So that means that our NHS Wales shared services are supplying the whole social care sector at present. So 40% of what we're supplying to NHS shared service is actually going to social care. And we're doing that. We've done that from the outset free of charge to the residential care sector. In England, they're being expected to pay for it. I think they've recently announced they're going to make it free for this stage of the pandemic. Now, that's important because there are financial pressures on the sector too. So we're taking away not just an area of concern about the worry of supply of PPE, but the cost that comes with it as well. At some point when we return to normal, we'll have to return to normal. That's the right thing to do now to keep people safe. We've also introduced a regular testing program within our care homes. There are some challenges affected by the well-advertised challenges of Lighthouse Labs about how speedily that's coming back, but that has helped us to understand and have a surveillance approach to whether members of staff are getting coronavirus and then our ability to isolate them and to protect residents. And where we have confirmed cases in homes, we are then looking to do wider testing to understand if it's gone into the care home population. So we're deliberately taking an approach that recognises the vulnerability of the sector and recognise that we'll need to do particular things around care homes to keep them safe. That'll continue to be our approach It's also why we're looking at how the NHS can help with infection prevention and control training. So the flu is a dangerous illness in a care home as well. People in care homes across the country die every year because of the flu. And we need that same approach to how we manage infectious diseases if it does come into a home. But the starting point is we want to protect homes from having coronavirus in the first place. And in the positive news, we've had a review done of every care home in Wales, and it appears that discharges from hospitals were not a factor in increased levels of coronavirus in care homes. It's actually the traffic and transport around the community. That's why visits have ended in some parts where there's a higher prevalence. But it's also then about the staff group as well. So we're trying to have a consistent staff group, so we don't particularly want agencies sending people to lots of different homes, because there's a much bigger risk of spread, and it's why larger homes and larger staff groups have a different risk. So there's quite a lot in each of the pictures, but it's important for us to understand it and then try to make the right choice to keep everyone safe.
Is the impetus now urgently trying to find a vaccine? If so, does the Welsh Government have to contribute to a pot? Is there a national objective for that? And is the Minister aware of any testing of a vaccine? Specifically, again, would that be tested on animals or people?
Well, we're about to, I don't know if there's what they call challenge trials, where across the UK there are fit, healthy volunteers who will volunteer to be given a vaccine and then to be infected with coronavirus sometime afterwards to understand if it works. Now, there's a huge level of altruism there for those people prepared to do it, but in the testing that we undertake, we want to have a vaccine that is available and is effective, and we are already planning for how we might undertake that. I think if we get a vaccine, we'll have lots of people queuing up to take it, but I think people do understand the risk the virus has caused and the intervention into our lives. And yes, we have arrangements across the UK for both the procurement of the vaccine and then how each of the 4 governments will pay for that as well. So it's an area where we of course have differences between the 4 governments of the UK, but actually I think we've been best across the UK when we've sat down and had those grown-up conversations. And on this area, I think people should take assurance from the fact that all 4 governments are having exactly that conversation about how we keep people safe.
Final question. I'm not sure this would, be your particular expertise, but it's just on the economy. I know Ken Skates has announced more money support for Welsh businesses. The advice is to work from home where possible. It brings added difficulties for many. Is the Welsh Government considering one-off payments to enable people to work from home and meet the additional costs? And if so, would these costs apply to those whose businesses have been based at home before COVID-19? A lot of businesses are slipping through the net. What will Welsh Government be doing to ensure those small businesses who need that support don't slip through that net?
Well, Ken Skates' main announcement yesterday that was focused on small business support. So I think the best thing is to refer to the statement that Ken's made. We do have a continuing conversation about what more we can do with the limited resources we have in the Welsh Government. But actually, there's a broader conversation with the UK government. If we're introducing more restrictions, what can we do to support businesses and jobs? If people lose their business, if people lose their jobs, there is always a healthcare impact with large-scale loss of employment. And people intellectually will be familiar with that from times past, in particular the impact on health and on well-being. So as a health minister, I'm always aware that people losing their jobs end up with more demand in the health service. So I'm acutely aware of it. And again, I hope we'll have a large response across the UK to this, because we're not uniquely affected by this in Wales, but it's in all our interest to get this right. I appreciate the time, Alan, and I'm more than happy to talk with Llanelli online again in the future, because we've got weeks and weeks, if not months and months of this to come.
Health Minister, many thanks for speaking to us. Thank you very much.
Take care. Cheers, Alan. Have a good day.